Good afternoon. We'll now start. It's already 2 o'clock. So first of all, I would like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and at the end of the pep talk. As a reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. I have placed the link in the chat box. Okay. This is the sample of the certificate that you will receive if you get a perfect score on the OLETE. Another reminder, 50 OLETE certificates will entitle one to a voucher for ROJoson telemedical consultation. Another request is that please take the make a comment if you're not going to take the OLETE. Okay, place a comment in the chat box, give your feedback. Okay, while during the open forum, you can do it during the open forum or before we end the session. So let's now have a group picture taking. Please show your face, everybody. Okay, let's okay. Show your face. Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. The contents of the core course are shown here. Then from October 23, 2021 onwards, I've been tackling health disorder. Sample courses are shown here, and the health issue courses. Okay. So this may take 3 years or longer to complete. Depends on the interest of the participants. My pep talk today is entitled Low Value Operation, Circumcision. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the issues of circumcision as a low value operation. Okay. So we talked about low value operations last time, and also low value medical care in the past 2 weeks. Okay. The contents of the pep talk on this low value medical care circumcision will be the following. What is a circumcision? What are the different types of circumcision? What is low value medical care, low value operation? Why is male circumcision considered as a low value operation? And what are the tips in avoiding or reducing circumcision as low value or unnecessary operations? Let's start with the first topic. What is a circumcision and what are the different types? Strictly speaking, there are 2 types of circumcision. Most of you are probably familiar with the male circumcision, but there's such a thing as female circumcisions. But male circumcisions are far more frequently done than female circumcisions. For today's pep talk, I will focus on male circumcision. However, allow me to give you first a brief idea on the female circumcisions. Female circumcision is also known as female genital cutting, or as the World Health Organization would call it, female genital mutilation, FGM. Okay. The prevalence is that it affects over 200 million women worldwide, okay, in 30 countries, with an additional 3 million women and children at risk annually. So every year, there are 3 million women and children being having female genital mutilation. This is a procedure that intentionally alters or causes injury to the female genital organs, usually for non-medical reasons. Okay. It is carried out from as early as infancy, okay, until age 15, although in some areas it is delayed until just prior to marriage of the females. There are 4 types of circumcision described by WHO. Type 1, you just remove the prepuce, this one, okay, with or without excision of the clitoris. Okay. Type 2, partial or total removal of the clitoris and labia minora. And then type 3, it's the worst, okay, including everything, and then just close, make it smaller, okay. And then type 4, just any harmful procedures to the genitalia, including scratching, pricking, okay, and others not specified in the first 3 types. So the worst here is type 3. Okay. The complications of the FGM consist of 2 types, acute and chronic. In the acute complications, you can have bleeding or hemorrhage, pain, of course, septic shock, genital edema, infections or abscesses, urinary retention, broken bones sometimes, and death at times. Okay. For the chronic complications, you have urinary tract infections, vaginal infections, difficult labor or delivery, especially in the type 3, dyspareunia, okay, also in the type 3, decreased sexual satisfactions. FGM is a cultural practice performed predominantly in Africa, the Middle East, and some parts of Asia. Many in the Western world consider FGM to be a human rights violation, and there have been international efforts now to eliminate this practice. Personally, I don't know if female circumcision is being practiced in the Philippines. Hopefully not. I don't know. If being done, it is a low-value operation, meaning there's harm with no medical benefit, unnecessary costs, waste-limited healthcare resources. Now let's go to male circumcisions. So as you know, male circumcisions, the Filipino term for this is tule or tuli. Okay, this is frequently done in the Philippines, frequently done for cultural and religious reasons more than medical reasons. Okay, for Muslim and Jews, basically it's mainly religious reason. For Christians, okay, since Saint Paul already said circumcision is not needed for salvation, the circumcision being done for Christians are more for cultural reason and peer pressure. The surgical procedure runs like this. Okay, so there are several types. Dorsal slit, just cut through the prepuce. Okay, and then excision and partial removal of the prepuce, the foreskin. Okay, partial and then total, and then the other one is excision using an instrument called GOMCO in the newborns. There are other types of instruments being manufactured now, being done to facilitate circumcision in the newborn. So basically dorsal slit, then excision, whether partial or total, just to expose the glans penis, and then for children, for newborn, usually they use special instruments here. Now, what is a low-value medical care or low-value operations? We have discussed this before. Let me just have a review. Okay. Low-value medical care is defined as a medical service or care that provide little or no benefit to the patients, have potential to cause harm, incurred unnecessary cost to the patients, or waste limited healthcare resources. When I say no or little benefit, this is in terms of effectiveness. So not effective in the goals of the medical service rendered. So what is the goal of, example, what is the goal of circumcision? Is it, let's say, if it's this or that, is it that effective? Now, the other criterion to use for to say that it's a low value medical care is that it has the potential to cause harm. So this in terms of risk for unwanted side effects or adverse effects like complications and even death when the medical service is rendered. Unnecessary cost to the patients in terms of money spent by the patients and families to the medical services rendered, which is considered unnecessary. And the last one is waste limited healthcare resources in terms of unnecessary usage of a finite government funding or budget for health of citizens like the PhilHealth, and unnecessary usage of finite number of services like the hospital beds, tests, and procedures. Low value medical care can also be equated to so-called, it's unnecessary. Okay, to be blunt about it, it's unnecessary and not needed. Okay, primarily because no little benefit and with the potential to cause the harm. It can also be known as or be considered to be not indicated, okay, not in the best interest of the patients when weighing against other available options, including watchful waiting and other conservative measures. So in contrast to low-value medical care, you have such thing as high-value medical care. Yun ang kabaliktaran, okay, katumbas, okay. High-value medical care is providing the best medical care possible, efficiently using resources and achieving optimal results for each patient. What are the different types of low-value medical care? So you have essentially three types: unnecessary medications, unnecessary diagnostic tests, and unnecessary operations or surgeries. We have discussed this before. Okay. So low-value medical care unnecessary operations just means the performance of operations that provide little or no benefit to patients, may be harmful, incur unnecessary costs, and waste helpful healthcare resources. Okay. So examples of low-value unnecessary operations or surgeries are the following. Circumcision is one of them. Cholecystectomy for asymptomatic gallbladder stones, gallstones without any symptoms. Then gallbladder polyps also without symptoms. Okay. So these are considered low-value medical care under the category of unnecessary operations or surgeries. Now, the question is, why is male circumcision considered as a low-value operation? Okay. The use of circumcision for medical or health reason is an issue that continues to be debated up to now. The American Academy of Pediatrics, AAP, found that the health benefits of newborn male circumcision outweigh the risk. Okay. May benefit nga, but the benefits are not great enough to recommend universal newborn circumcision. When you say universal newborn circumcision, so it should not be routine. Okay, so the conclusion is it's not routine, and it must be done only as needed. Okay, so these are the several indications for doing circumcision at the newborn. One is phimosis, meaning the foreskin is too tight to be pulled back over the head of the glands of the penis, masikip. The paraphimosis, the inability to return the foreskin to its original position, ayaw na bumalik. Recurrent urinary tract infection due to foreskin problems. As we know, there are other problems with, there are other causes of urinary tract infection. If it's not due to the foreskin problem, then it's the circumcision is not indicated. The cited circumcision benefits, those who are favoring circumcision, is that there is less risk for urinary tract infection, but this is not totally true. A reduced risk for sexually transmitted disease in men, again, not totally true. Protection against penile cancer and the lower risk of cervical cancer in female sex partners. Now, again, this is very, very rare, so it might not hold water. Prevention of balatinitis, inflammation of the glands, and balanopostesis, inflammation of the glands and foreskin. Again, this is not very common. This is very rare. So in reality, these are uncommon benefits that are being forwarded by the advocates of circumcision, and they can be prevented by non-circumcision measures like hygienic practice and safe sex. The circumcision risk, these are known circumcision risks. Earlier, I talked about the alleged benefit. Now it's the risk. Okay. The risk will be the pain, okay, very common. Risk of bleeding and infection at the site of the circumcision, irritation of the glands, higher chance of myositis or inflammation of the opening of the penis, and risk of injury to the penis. And although rare, at times it can cause death also to the patient. Okay. So you can see the pain, illustration of pain, okay, during circumcision. Another one, okay. Another picture of illustration of pain, okay. Okay. So those routinely done for cultural reasons or for peer pressure are considered low-value operations because they provide no or little benefit, okay. They can cause harm, incur unnecessary costs, and waste limited healthcare resources. What are the causes of low-value operation like circumcision? Primary factor would be the physician-driven factors. Secondary factor would be the patient themselves. And then tertiary factor, the health systems factor. Physicians are considered the primary factor because they encourage and promote circumcision despite knowing it is driven more by cultural reason and fear of peer pressure than medical reasons. And of course, they stand to earn financially if they promote circumcision. The different types of physician-driven factors are the following: mindset in the medical management of the doctors. You have such thing as ritualistic and maximalist physician mindsets, and then financial gain, whether incentivized or non-incentivized, wish to please patients or consumers, okay, because of the mindsets of the patients and their desires over the necessity or rationalization of the procedure. And then there is no clear presentation and discussion of options of management by the physician. There are three types of physicians based on their mindset: ritualist, maximalist, and minimalist. The ritualist physicians are those who just make medical management decisions based on habits and not mainly on critical analysis. So they go by the trend, by the fad. Okay, so this contributes to low-value medical care. Maximalist physicians are those who institute medical management that includes a lot of things that are not essential. Okay, so these are so-called nice-to-have treatment or healthcare. So this can also lead to low-value medical care. The best will be the minimalist physicians, those who institute medical management only that includes only which are not which are really essential, really needed by the patient. So this will contribute to high-value medical care. So the second driven factor is the financial gain, both incentivized and
Doctor, wala kang audio.
Kanina pa wala.
Kanina pa, Doctor. Can't hear you.
Ngayon, naririnig mo ako? Ngayon,
Financial gain.
ha?
Ngayon meron. Pero kanina since doon sa financial gain, wala ka ng audit.
Okay. Anyway, okay. So,
I've been messaging you eh.
nag-i-interrupt yung internet eh. Nag-i-interrupt ba sa inyo o sa akin lang?
Sa'yo lang.
Sa akin lang. Signal ko ang pangit, no? So anyway, but you saw the slides. You saw the slides with no sound lang. Is that correct? You saw the slides?
Yeah.
Okay. At least you saw the slides, no? Okay.
Yeah. We did.
Okay. So yung explanation lang ang nawala, no? Okay. Sorry for that kasi ewan ko nagloloko yung mga internet ko ngayon, no? Okay. So any question about circumcision? Let's just try to make it. Okay. So in the Philippines, maraming may circumcision, probably more than 90% now, but there are now people who are becoming more aware. Okay. So yung mga iba ayaw na rin magpa-circumcise. Yung iba naman, adult na sila, and then they don't like what happened to them, so they try to seek doctors who will reconstruct. Okay, so gusto nila ibalik, no? Okay, so may mga pasyenteng ganon, no? Pag adult na, no? Okay, so I hope you can help in that advocacy against circumcision, because if you don't, your children, grandchildren, tuloy-tuloy yan, walang katapusan yan, no? Okay. Because most of the times due to peer pressure lang naman, sabihin ay baka matukso na ano, I think that's what's the term? Anong term ginagamit ng mga tao? Ng mga ano? Bakit anong term ang ginagamit?
Support.
Ha? Anong term ginagamit pag kinutukso yung bata dito ulit?
POT. S-U-P-O.
P-O.
Support.
Support.
Ha?
Support. Support.
Ano? Hindi ko kita marinig.
Support, doctor, support.
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 Okay. Yun. Okay. So, I hope in the future it will not come to the point it could be kasi may mga mga paka-bullying, di ba? Bawal na yung bullying. Kung minsan maabot ng bullying, di ba? Okay.
Yes.
So, wala naman kasi kung minsan, pag baby pa lang, syempre maliit yung butas, no? Okay. Pag habang lumalaki yung pasyente, yung bata, lumuluwag din eh, no? To the point that kahit na hindi ka circumcised, no? Pag malaki ka na, parang circumcised ka na, maluwag-luwag na, no? Okay. So, yun ang ginagamit nila kamisan yung reason na ano, na itutuli because maliit ang butas, no? Okay. Then may mga
Yung anak ko, Doc,
yung
anak ko, ayaw niya magpatuli.
Good. Well,
Pinsan.
oh, good.
Kaya pinsan, ayaw niya. Ay, nung malit siya, sabi ko, magpatuli ka na kasama mo pinsan mo. Ayaw ko, masakit daw, sabi niya. Hanggang ngayon, binata na, ayaw. So,
Good.
okay lang pala.
Okay. Okay lang yun. No? Okay. So, actually,
Nabasa rin niya doon sa clinic mo, Dok,
aha.
na no benefits yung nabasa niya. Mami, sabi niya, ayan no, nabasa ko. Pwede pa lang hindi magpatuli. Tumawa lang ako. Okay. Hindi ko na siya pinilit eh.
Okay. So, masaya ako. Nakatulong pala yung poster ko.
Ngayon, now I understand.
Dati may poster ako sa clinic ko sa labas, di ba?
Yeah. Merong poster doon. Sabi niya, nabasa niya. Okay lang pala eh. Sabi niya na hindi magpatuli. Ayaw niya talaga Dok. Binata na siya ngayon. He's already 22 years old. Ayaw niya.
Okay, good. So, hindi kailangan. Basta, wag siya matakot na magkakaroon siya ng cancer, di ba? Kasi yun ang sinasabi, cancer, hindi totoo, no? Okay. Hello? Naghang? Okay lang? Naghang ba? Hindi. Hello?
We can hear you, Doctor.
So, hindi totoo yung that can cause cancer. And then, kasi cause ng cancer, iba naman yun eh. No? Basta hygienic ka lang, walang masyadong problema. No? Okay. And then, in terms of STD, usually, yung sinasabi nila in the Philippines, sa Africa, nababawasan ng AIDS because of circumcision. In the Philippines naman, kahit na 90%, more than 90% circumcised, tumataas pa rin ang AIDS natin, di ba? Okay. So it doesn't hold true, di ba? Di ba? Tumataas yung incidence ng AIDS natin sa Pilipinas. Okay. So kahit na more than 90% are circumcised, no? Okay. So the only thing that you cannot really control, yung mga religious lang, no? Yung Jews, di ba? Kasi meron silang belief, di ba? So which we have to respect, no? Okay, but for the Christians, hindi na kailangan, di ba? Sabi ni St. Paul na Gentiles do not need to be circumcised to become Christians, di ba? Okay. Okay. Any more questions? Masaya ako ng kinuwento Phoebe. Okay? At least nakatulong ako ng isa, dalawa. Tama na yung isa, dalawa. Okay. So, kung may kamag-anak kayo, try to find them. No?
Yes,
So, every now and then I receive mga email, no, asking me kung paano, how do you come out with an advocacy like that, di ba? Kasi gusto nila mapigil din itong yung mga tuli left and right, di ba? Yung mga doktor tuli ng tuli because kumikita sila, di ba? Kahit na 3,000, maliit lang, by volume, malaki na rin yan. Okay. So, saka yung mga tinutuli sa mga libre, usually yung mga hindi naman expert gumagawa noon, di ba? Nasa mga nasa schools, di ba? Kung may mga baka magka-infection pa, di ba? Okay. So, ay nako, laging nawawala. Wala na naman. Putol na naman. Ewan ko. I have to check my internet. No? Okay. So, I'll try to make a recording muna. Okay? Recording ulit. Then, bibigay ko na lang. Pero may mga portion na meron, no? Mga portion na wala.
Yes. Latter part. Yung first part ng lecture. Start sa financial gain. Simula from there up to the end, nawala na yung OQ mo.
Okay. Sige, I'll try to make a recordings, no? Para i-share ko rin sa inyo, no? Okay. So, if there are no more questions, no? So, let's call it a day. Next topic will be, next week will be more, very interesting, no? Hindi pa rin ako tapos, no? Ang hirap gumawa ng lecture on yung mga how to interpret laboratory tests, no? Laboratory test results, no? Okay. So, kung wala nang tanong, let's call it a day. I'll try to make a recording of this one again, then give it to you, no? Okay. Okay? Walang questions sa chat box? Walang questions sa chat box, sabi? Puputol din, no? Walang questions sa chat box?
Wala, Dr.
Sige, let's call it today. Talagang pangit ang signals ko
Oo
rin.
nga, nag-freeze ka, you're in and out eh.
Oo. Okay. Sige, so next week naman, laboratory test na lang. Na? Okay? Sige. Okay.
Thank you po.
Thank you, Doc. Thank you so
Doc.
much.
Doc.
Thank you.
Thank you, Doc.
Salamat po.
Thank you, Doc. Bye-bye. Thank you.